The sphenoid is the keystone to the skull and provides the rhythm for the other cranial bones. Both the falx and the tentorium attach to the sphenoid. The sphenoid nosedives during flexion, then pauses and reverses this motion in extension, creating a lazy 8 pattern. In the opposite motion model, each wing of the sphenoid alternately moves into flexion. The sphenoid and the occiput are joined at the spheno-basilar junction. It is because of this sacrum-occiput-sphenoid connection that clients will frequently feel their sinuses clear or experience some other sensation in their head while you are working on their sacrum. The pituitary gland rests next to the sphenoid. If the sphenoid is compromised in its motion, it can affect the pituitary and the entire endocrine system. Check the sphenoid for restriction when clients have headaches, sinusitis, back pain, learning disabilities, temporal mandibular joint dysfunction, or vision problems. Our first technique is the sphenoid release. Sit at the head of the table and lightly rest your fingers on the occiput. Place your thumbs over the wings of the sphenoid bone. As the sphenoid is halfway between flexion and extension, very gently encourage the greater wings to move posterior or towards the table. This motion compresses the sphenoid towards the occiput. Hold the sphenoid in compression for a few seconds until you feel it start to gather energy or ask to be decompressed. Now with your thumb pads, gently guide and encourage the greater wings in an anterior direction or towards the ceiling. As you feel the sphenoid float upwards, you will notice a freer and larger cranial rhythm. This is the basic technique. The next step is to evaluate for specific motion in the sphenoid bone by encouraging motion in the following directions: flexion, extension, side bending, torsion,